All right, y'all, let's talk change of condition again. Okay, so you are a long term care nurse, you are a floor nurse, you are a charge nurse, you are working with patients in the long term care community. If you are on a hall and you have a patient, excuse me, that has a change of condition and they are on hospice or they are enrolled in a managed care program, so that could include things like Optum or PACE, right? Are you responsible for assessing and addressing their change of condition if they have additional services? Okay, so the answer is absolutely yes. You are still that patient's primary care nurse, right? So what does that mean? If you get a report from the night shift, you're coming on today, whatever, your CNA tells you that there's a change in condition with one of those patients that has an additional service involved, you still need to go into the room, make sure you have vitals, and you assess what's appropriate, what other system, if it's head to toe, whatever it is, you need to do an actual assessment, right? And then you're going to take that information and you are going to follow up with the proper team. So whether that's hospice, whether that's a primary care group, if they don't have a managed care program, or if they do have a managed care program, you're going to follow up with their provider from that program to get the next direction and orders. Okay, though some of those programs do have right, we know with hospice, right, there's a nurse on the team, there's CNAs, there's etc., right? In Optum and those PACE programs also have nurses working for them some of the time as well to help triage, and they're calling and they're coming in, and there's various moving parts to the situation. However, in long-term care, that's still your primary patient. So you have to do the parts and then collaborate as a team to get things, arranged for the patient. So I just wanted to share that little jewel, because I feel sometimes people, that maybe are new or whatever, may misunderstand what that looks like. We're all a team, but you're still, when you're the front facing nurse, you're still responsible for those initial steps, and working with the team to collaborate.